It seems no amount of threat is enough to stop South Korean doctors from protesting against government's way of dealing with shortage of doctors in the country. The government has asked the doctors to return to work by February 29, that is Thursday, else face legal action including suspension of their licenses. The government on Wednesday assigned nation's military and community doctors to hospitals starting in March under an emergency healthcare program. Two-thirds of the nation's residents and interned doctors had walked off the jobs to protest a government plan to increase the number of students admitted to medical schools in a bid to address what authorities say is a shortage of doctors. The protest led to disruption in services at large hospitals, forcing some patients to cancel surgeries and procedures. Okay, DD India correspondent Chris Gilbert joins us with more from Tokyo. Chris, good morning. Get us the latest. How do we see the strike or the situation further pan out? We've seen the South Korean government give the ultimatum to the doctors.
Good morning. Well, I think you summarized the situation very nicely. There doesn't seem to be any end to the standoff between the striking doctors, the resigning doctors, and the government. As you mentioned, the health ministry has given till the end of today. There has been a last-minute request, or I guess you can say a reminder of the ultimatum that they have given these workers, which is to return to work today or effectively face legal action or have their licenses revoked. Few doctors seem to be heeding this call. About 9,900 have resigned, 9,000 have walked away from their hospitals, about 300 have returned. In response, the health ministry has filed complaints, official complaints against 5 heads of the doctors' lobby, and they have begun visiting the homes of trainee doctors as well to try and get this ultimatum through, as doctors have reportedly been turning off their phones so they cannot receive the calls or text messages from the government telling them to get back to work.
All right, Chris, explain to us how is the medical sector there panned out, because the doctors are opposing the stance of the government to bring in more doctors to tackle shortage of medical staff. Having said that, what options are the striking doctors? Are they giving any options to the government? And for that matter, what is the take of the government on the strike ahead?
Yeah, I mean, it's a deep situation in South Korea that really goes to the core of society, with the depopulation issue, with the lack of doctors in the rural area. It's very vast to cover the entirety of it, but very briefly, the government is facing, as new data shows today, a worsening depopulation crisis, a falling fertility rate, and they need doctors in the countryside. Medical schools have about 3,000 seats available. They want to boost it to 5,000 seats to get more doctors effectively. Now, even though the simple answer is that the trainees are protesting in reaction to that policy, that's not the whole truth. The whole truth is the doctors themselves are saying that this policy is not going to fix the things that they have been complaining about for some time, that they have been saying their hours are too long, 36-hour shifts, 100-hour weeks. They say they get paid about $2,000 less a month than trainee doctors in the United States. They say they are open and vulnerable to malpractice lawsuits, and they want more legal protections, and that the government's latest action has been to increase the number of seats at medical schools, which is only going to increase competition. Now, the public, about 70% or so, are on board with this government plan. One could assume potentially they're also on board with the hard line that's taken by the government. But the fact that senior doctors are also protesting in solidarity with the junior doctors, although not resigning, suggests that this is also a situation that they experienced when they were trainee doctors or interns or doing their fellowships, and it is part a problem that is endemic in the South Korean health system and needs to be addressed at some point.
All right, Chris, thank you for joining in with those details.